Good morning, good afternoon, and good evening, wherever you're at in this big, beautiful world we live in. My name is Cody, and I am the host of Behind the Premium podcast. Thanks for tuning in. Have we got a good one for you? And it all starts with Rockstar, 5-star HR executive, a man who delivers and gets results, a game changer. Those are just a few of the quotes from the massive list of testimonials that are found on today's guest's LinkedIn page. So if you want to check them out, definitely look this person up. 20 years in various roles from HR director to chief people officer. He's built many award-winning cultures at multiple different organizations, then walked away from his corporate roles to do things a little differently. Now he's disrupting the HR space in a whole new way. As a public speaker, university instructor, a fractional HR consultant, he is revered as one of the top go-to HR consultants in Utah, or for pretty much any company that's looking to push the status quo. But we can't forget probably one of his most favorite titles of his career to date, and that is Grandpa. Joining me today in today's Behind the Premium episode is Rod Lacey, a disruptor in the HR space. How are you, my friend?
Oh, after that intro, I feel really good, Cody. That was very nice to hear. Very kind. You pulled some nice little excerpts out of those things. I appreciate that. No, it's good to be here. I appreciate the invite.
Yeah, no problem. And I know you've been with us on a previous episode, a roundtable discussion, where we invite multiple various peoples, brokers, HR people, wellness coaches, all that kind of stuff to debate a lot of the stuff that is going on behind the healthcare, small business healthcare crisis that we are all experiencing. But after talking to you, I do have to come clean. I've known Rod, probably 20 years now almost.
So, yeah.
And and we've crossed paths quite a bit. And after hearing him and the way that he was passionate about what he was saying on the previous episode of Behind the Premium, we felt it would be great to sit down with him and get to know you a little bit better and why leave the corporate world to start up your own thing. I think that's the big question that a lot of people are asking, and what makes you so disruptive in the space. And we'll get to know that here in just a little bit. So I guess we can just dive right into it. I mean, do you want to add anything else to that intro? Did I miss anything? I know you appreciate it, but did I miss anything there?
No, I think instead of Grandpa, it's Pops. I mean, so it's
Pops.
Yeah. Sometimes I guess we choose the grandparent name, but that's what was chosen for me. So yeah, it is a favorite new role for sure.
That's awesome. And I know we can go down some rabbit holes on that one because you are pretty passionate about your grandkids. That's awesome. But for most of us, we're here to talk about why you disrupt. So I think the golden question, the elephant in the room is why, after like a 20-year career climbing the corporate HR ladder, why did you just give it all up and decide to walk away from that executive role and start Sunstone HR?
It's a great question. And I think I've spent years of my life, at that executive table. I was thrown into a vice president role, reporting to a CEO before I ever deserved it. And so I've been attending these executive meetings, helping companies build their brands, for most of my career. And right now, the way the corporate world is going, it's not great in some ways on the people side of the business.
Right.
Where I've had my best success are organizations that value people, that recognize that they're not just numbers on a spreadsheet, that they are human beings with skills that can be developed, that they grow, they learn, they're valuable. If you look at the climate with layoffs today, I was just looking at statistics. We're about to hit 1 million layoffs in this year, 2025, 1 million layoffs, most since the pandemic. And it's just, that's what the people space has become, is just let's cut, let's eliminate, and where I guess it just makes it really hard to build what you want to build, to deliver what you're able to deliver if the focus is just there. And so the move away was a chance to try to influence organizations for the positive, those that are willing to, focus on the people, those that are willing to, it really is not even just an investment. It literally it's an attitude. Those that are willing to pay attention and recognize the value of the humans in the building, that's who we want to work with. And, I've done my share of layoffs, and HR professional needs to do the good and the bad. But if you could choose, Cody, would you choose to focus on the good for the rest of your career, or be subject to the whims of a private equity group or something where you execute based on spreadsheets and templates and, I guess, cut costs quickly schemes? And so it's a chance to influence organizations, and not just one, but multiple organizations in such a positive way.
Yeah. Yeah, I would definitely agree with you on that. I would love to do the good for the rest of my career. That's for sure.
That's a simple formula, right? It's a simple formula.
It is. And, that's awesome that, you kind of walk away from there and start focusing on the humans. And I think it's become kind of a real rationalization that, with COVID coming in and people being able to work remote, it really widened the pool and allowed you to go after some really good top tier talent that not only helped you execute in production, but also growth and that way. But I'm curious, when we talk about that kind of stuff, like it's hard to be humanized, as you said, concerned about your employees when they're all remote, and it's really easy to treat them as kind of like a freelancer, or in your case, like a consultant, right? That can easily be cut and let go when the budgets aren't there. And how do you combat that with your situation that you're in as a fractional HR person, and kind of instill, hey, these remote people are just as good as the in-house people, and how do you kind of block that mentality out from big CEOs thinking of the bottom line more than their employee line?
Yeah, that's it's an interesting discussion, and there's so much behind it. So at the highest level, I'll just say it's an employer's market right now, meaning there are times think about home selling, buyers and sellers market, right? We all understand who has the power in the equation. Right now, with all the layoffs, low job creation and job openings, higher unemployment than last year, the employers can dictate where they want people to be. I want you in the office. We're good with hybrid or remote. So right now, the employees are open to taking whatever they choose to take. But to your question of the value, the way that you create the value equation for these employees wherever they sit is with the connection you've got with them as a manager. It's about understanding who they are and valuing them the same as the people that you might bump into in the building. There's amazing talent. I remember when we, first early COVID, again, this is no disrespect to my immediate community, but I didn't hire in my same state for a couple of years. Literally, I could choose from all over the world who was going to join my team, and I did. And so there's great talent out there, but some of these people I'll never meet. Some of these people I'll never see face to face still. And I didn't see them but that connection, that relationship, you got understanding who they are, valuing them as a person, understanding what they bring to the table, and giving them chances to contribute. That retains them, that maximizes the value. But yeah, if you are just running an organization where you've divided it into two pools, those that are close to home and those that are elsewhere, it's too easy to slice, and it creates a big disconnect, but it doesn't have to be that way.
Right. I agree. One of the things that I was listening in preparation for this interview, I was listening to a couple of your other ones that you did, and I'm trying to remember, I think it was on Disrupt HR's stage that you did like a kind of like a mini TED Talk thing, which was pretty cool. Correct me if I'm wrong, but I think it was talking about like doing more with less.
That's right.
And shaping the next generation of HR professionals. And I love that. And I love how you combine that with your teaching efforts that you're doing at Utah Valley University, which is phenomenal, because I think that, to your point, I think right out of the gate, like one of the best ways to disrupt the HR community is to get to the root, to the quote unquote newbies that are coming into the space, to kind of instill that mentality or that philosophy in them. So I'm curious, you know, with the big idea around Sunstone, why you left, all that kind of stuff, what is it really that you're doing in the HR space to disrupt and really make, you know, CEOs, managers really think about those employees? Is it benefits? Is it, you know, programs that you're doing? Is it free soda? Is it, I think one place you and I used to work at, was it free meals, you know, type of
Free
thing?
meals, pickleball courts, yeah.
Yeah, you know, what is it that you guys are doing? It seems like there's a lot of HR people out there trying all these different things when it comes to people strategy, but what is it specifically that sets Sunstone apart from the rest?
That's a good question. I'll first say that I'm very selective who I bring on board. And I say that again, not that there's amazing HR talent out there, but there are many levels of contribution in HR. Where we want to be is at the most strategic level. And that's what I'm trying to do at the university level, is teach these up and comers the highest level of contribution that HR can make in an organization. And so again, HR can fight fires and answer emails and Slack messages and be busy every week for their career. But it's when we drive strategy and help organizations grow, that's when we're really performing our role. So I focus on identifying people that are coming in with that background. And if I were to compare what we do to what is traditionally done, our primary customer is a smaller business. Now we can work with businesses at all sizes, but think about the small business. You know, Cody, you started some businesses. At what point did you think about hiring your first HR person? It's way down the road, right?
Right.
And it's an expense, and you're probably going to bring someone on junior because it's going to be expensive, and you'll groom and grow, and hopefully you'll get it right during those early and important stages of your business. What we do is we take that spot. Throw a vice president in there a few hours a week, you get insights on how we have grown businesses, how we have driven profitability, how we have improved margins, and we help you scale your business with just a few hours a week. So for less than the cost of adding that first clerk, we come in and tell you how to do it at the next level, whether it's systems, tools, structure, hairy situations that you might have gotten yourself into. We come in on an hourly basis and throw knowledge, insights, and wisdom in early in that growth stage, as opposed to having, to start someone at the junior level and letting them grow with you. And so, there's a great value proposition there. In again, just a few hours, we can deliver incredible value.
So if I'm reading this correctly, because you're right. I mean, once I've started a company, it's down the road. It is somebody that's new or green. I mean, I've even looked at fractional HR companies before, where it to me, it feels like a very out of the box experience.
Yeah.
It's a cookie cutter type of thing. Like, yes, for this price, we'll do this, and this. For this price, which is our most popular price, we'll do these things. And then if you want custom, we'll do custom, right? It sounds just very, very similar to what we see on a sales page type of thing. But from what you're describing to me, it almost sounds like you're taking a proactive human approach that a lot of these other HR people are not really offering, right? It's getting in deep. It's not taking everybody on. You're being very selective. Am I kind of reading between the lines here too much, or?
No, you've got it. And so to clarify, there are organizations that call themselves HR consultants, and they provide like a compliance package or this, and they're set up for a monthly or weekly retainer. We respect the individual organization, meaning that we don't work from retainers. Every organization is unique, and the small businesses where we focus, they don't know what they need. So why would I lock a small business into, you must have this much of me per week? They don't know. And so we come in and we are very particular to their culture, that CEO's aspirations and goals. We learn about the organization. We try to become ingrained in the organization to the extent that we can be, and we help them grow. But it is, every organization's needs are unique. Sometimes they need a recruiting focus. Sometimes they need a handbook review. Sometimes they've got a big claim that's coming against the company and they need help wading out of those weeds to figure out what. And so our approach is always custom. And so we can do, again, bringing in someone at the level that we've got, we can do everything, but we're going to tailor our approach to the needs of the organization.
Yeah, I like that. And, it's interesting too, because, those cookie cutter type of things, they're great. But, when you kind of look at what you're talking about, getting in with a VP, trying to ingrain yourself as much as possible, I mean, there are some levels of trust there, but then there's some resistance as well. How do you combat that, being a fractional HR, sorry.
Yeah, no,
I'm a fractional CMO, CXO type of thing. So, all these acronyms get thrown out there, but I'm curious from your side, because I mean, from mine, it is a little bit different, because I can walk into a consultancy or a client and basically say, okay, these are the things that are broken. These are the things that need to be fixed. Here's where low hanging fruit is, mid-range, long-term, and that's great. And for me, it feels like there's a whole different level of trust than it would be for an HR person coming in there, because you guys are like almost pulling back the curtain, looking at the dirty laundry of things and really seeing what's there. How do you combat that from your side?
Yeah. So where we love to play is as a member of the team. I've got multiple email addresses that is, might be HR at, or Rod at, or Rod Lacey at that employer. And I've got a calendar at those employers, and I make myself available to those employees. And if, I've got a couple that like for me to be on site every once in a while. And so we keep our balance, our account load, where we can be very responsive to the employee inquiries. We provide supervisor training, manager training. We'll participate in executive or leadership meetings and in the employee, like all hands or town hall meetings. That's where we like to play, is let us be, again, we're just part-time, but let us be a member of the team, make us feel internal, and then we'll be available as needed to the employees. And so we build these relationships. Sometimes it's remote only, and sometimes it is face-to-face. But we build these connections. We're available. We listen. We run the surveys we run payroll. We do everything that an HR team might do. And so to these small business, we are HR, where they email me at their URL. They don't email me at my consulting. And so we have a chance to kind of ease in there as a part-time member of the team, and it works out really well. We can play behind the scenes too. We do for the larger organizations, we do a lot of project work, where we just sit behind the scenes, and then we hand, the HR teams all these strategic supports. Here, we rebuilt this for you, we built this for you, here's, and we just hand it them, they take the credit. So we can do, we can support in a couple of ways, but where we like to play is just a member of the team.
That's awesome. Yeah. And, again, if you go and look at Rod's testimonial section from his LinkedIn page, you'll see that a lot of the clients, a lot of people that he's worked with have all consistently mentioned that you've helped the organizations become the best place to work. I don't know if any of the places you've worked at have won the Utah State Award or any state award like that for best place to work. But, it really does sound like hands-on experience, all that kind of stuff. And you've kind of resonated that to Sunstone HR, which is awesome. So if you guys want to know more about Rod, I highly recommend you go check out his testimonial thing, because there are a lot of interesting things that you guys have done that they've called out, which is awesome. But I want to kind of talk a little bit more about the Sunstone, because you started out in 2017, I want to say?
2017, yes.
Yep. And you grew up from one person to how many do you have now? Tell us a little bit about who's behind the scenes, that kind of stuff.
Yeah, so like many consultants, I started my business just to fill my own calendar. Wanted to keep busy. I'd left corporate, late 2017, and that, it's time to do my own thing. And so I built it, got busy in a decent way, and then I just kind of maintained my calendar for a while.
Yeah.
Got to the point where I was turning down clients, again, people that I would have loved to have worked with, great companies, great opportunities, just because, if it's just my calendar, there's bandwidth is what it is. You can work 24 hours a day, but that's not healthy. And so I decided to bring on other consultants so that I no longer had to say no. So thus began the selection process of who do I trust, who has the same, I guess, passion about driving results, serving these CEOs, who can do what I would do because, you're a brand owner, Cody. Your brand's important to you. Sunstone's important to me. And so I wanted to make sure that we were successful. So brought on people and started saying yes to additional clients and then handing them to a team of very accomplished consultants. And so, bigger now than it's ever been. And I think the demand for the fractional side of the HR space is just starting to grow.
Yeah, I would agree with the fractional side of it. And it goes back to what you were talking about, doing more with less, right? I think that a lot of us are finding, especially business owners, are finding themselves being squeezed in just about every single direction. And so trying to get creative, trying to find new means for, shall we say, how to skid a cat, many different ways to skid a cat.
Yeah.
It's or rub those two pennies together to make keep them covered in. So we got to get creative. And I agree. I think that the fractional freelance consulting kind of thing is definitely becoming a very, very popular thing, especially after the COVID. That seems when my consulting went through the roof as well. But yeah, that's interesting. So how many did you say that you have currently on your team? Or did you?
5 additional consultants under the Sunstone brand right now.
Okay, cool. Perfect. And you guys, are you focused just here on Utah? Are you focused around the nation?
We're around the country, and we even have international clients. So I've got like one consultant in the Bay Area, another one in New York. But yeah, we picked up a client from New Zealand recently. And so we are focus more on the U.S., of course, but coast to coast with a hint of global. It's fun.
That's awesome. I have a client out in Australia, so you and I can share a plane over, and we'll have somebody to talk to on that long flight. That's awesome. Yep. It is a long flight. No, that's cool. So I think one of the biggest things, obviously, we're behind the premium. We're here to talk about healthcare costs and the crisis that we have going on there. I'm curious, you being a fractional, HR person, how big of an issue is that for the businesses that you're currently working with when it comes to their 2026, healthcare costs and spend?
It's crazy. You think, again, the small business is so subject to the whims, the catastrophic claim and really just they're subject to whatever the insurance companies decide to do upon renewal. They've got few choices. It's been a rough season with the clients we've got on their renewals. We've seen numbers all over the place with our different accounts. And sometimes I gotta be honest, sometimes I have one account that was going, well, why should we involve that in insurance? I've always the CEO just always does that as well. Let me help you. We got behind the scenes and looked at different options. So anyway, sometimes these new accounts don't realize the value that HR can provide on this whole process. But I've been dealing with renewals since a long time ago. I won't be specific, but like literally, I was the benefits guy. My first job in HR, right out of college, benefits guy. And so I've been doing the renewal process forever, and it just keeps getting crazier and crazier. And so yeah, for my clients, it's been a rough season. It is. Every discussion is about the gives and takes. It's going to cost more. Where does that come from? And there's just no answers in sight as to what might rein this in, control it, manage it, make it better in the future. Yeah. When I used to teach a benefits class at Utah Valley University, and I would have my students rehearse. Everyone rehearse with me. Dear CFO, our premium rates are going up again next year. And we would just kind of laugh about it. But I mean, this was like 8 years ago that I was having them quote this, and we could have quoted it, 10, 12, 15 years ago, and could say it even louder today.
Yeah, that's crazy. I'm curious, what is the highest percentage of all your clients? What's the highest percentage of a rate increase that you've seen this year alone?
32%.
That's pretty high.
I know. Yeah, I know. And I know there's bigger numbers out there. I compare notes with others in my space, and I've heard some 64s and some. It's just, when you get numbers like that, that group doesn't want to insure you anymore. It hasn't been a good season. I did have one client come in at almost flat, which was a miracle. And so anyway, but yeah, the numbers are all over the place.
So when it comes to this kind of thing, I mean, there's multiple options that you can do as an HR person. What are kind of like your go-to things that you look to help navigate or guide? Let's start with the company as a whole. What do you do to help guide them to the best possible products and services, insurance premiums, all that kind of stuff for their employees? And then I'll ask you a follow-up question on that.
Yeah. So for a person, in an HR space, there's a balance. Too much change is upsetting to the employees. You could chase $1 every fall and change networks every fall, change TPAs or broker. But too much change is a challenge for employees. So you've got to balance the change versus the cost. Mm-hmm. And so, yeah, we focus as we sit with employers, looking at what comes back in renewal, starting first with if we do nothing. But meanwhile, having relationships with others in the benefit space, brokers and such, knowing where we might go if those numbers are unacceptable. And so it's that balance of should we flip everything upside down and try to flatten things out the best we can, and keeping in mind that my clients are smaller, so we're not looking at self-funding or anything like that as an option for change. So these are fully insured plans. But yeah, our options are limited because we're taking what the market's going to give us. And so what we try to do at the employer level is just help them shop effectively, help them, truly know what their options are. Again, they're not used to having, HR sit in these meetings with them and HR with insights over what's really going on in the market, what other companies are experiencing. So it's been a good process for our clients with that, but the numbers are not necessarily favorable. But that's kind of the role we play at the company level. Okay, that makes sense. Now, I do know that I was reading a report a few months ago, actually, and it was talking about traditionally about 65% of healthcare spend on benefits is typically wasted as a result of lack of education, lack of easy access to it. I mean, a lot of things that are included into your package from your broker are kind of like the car thing that you really don't need, but you need this one specific thing in there. How are you going about educating the employee and the employer of this waste? It's kind of a two question there, but I'm kind of curious your thoughts. That's a great question. Again, what these employers get is the brokers package it up and say, there's this copay, there's this coinsurance, there's this deductible, there's this out of pocket. They just package it and say, here, employer, let's what your options are. We have a gold, we got a silver, we got a platinum, whatever. And so they present that to the employer, and the employer shrug their shoulders based on cost alone and make a decision. Line by line, there's some things that might be too high, too low. Some things that might drive traffic to the wrong places, some places, or others that might prevent people from getting something that's more cost effective. And so we try to look at those types of things on a line by line basis to make sure that we're pursuing affordable, good care. Like, for example, is there an automatic charge for an ER visit that doesn't have an admission following it? Is there a better rate, like no copay, for telehealth as opposed to so looking at some of the line items to make sure that mentally the employees are pointed in the right direction is one of the things. And then it comes down to employee education after that. And that's always an uphill battle. Again, that new hire, you sit them down for 20 minutes, if you even sit them down, but they look at these 3 health plan and 2 dental plans and a vision plan, and you're asking them to make an informed decision on things like, copays, coinsurance, deductibles, out-of-pocket maximums, limits, stop. They don't understand that stuff. And so, again, I've always tried to educate employees. I've always tried to have mandatory open enrollment meetings, new hire sessions where we explain these things. Mm-hmm. But let's face it, just the average employee doesn't understand benefits to the level where they can make an informed decision. And if they start there, how can they make good decisions throughout the year? They don't understand what their coverage is. When they get sick, they go. When they get hurt, they go. Again, it's just the lack of knowledge, lack of understanding of a very complex system. It blows people's minds. Like, having worked globally, our healthcare system blows people's minds. They can't understand it. They just roll their eyes and think, I don't know how you guys do that. Well, we don't know how we do it either. It's crazy.
Yeah. I was reading a report and it said 86% of employees are confused about their benefits. And to your point about global, I was just talking to my Australian client the other day, and it was just, he's like, wait, what? How much do you pay for a pill? Because they don't allow pharma ads on TV there or anywhere. And I think the US and one other place in the world are the only two places to do pharma ads. And the amount of cost that's behind that is just astronomical, right?
Yeah.
But I totally get where you're coming from. You're like throwing a lot at them. I mean, I remember I joined up with a group. I was new. I had just moved there. I went into HR. They gave me 24 hours to choose my ABC plan. And I was living in California at the time. I had half my family here, and I had so many questions. And the HR person was just like, call our broker and they'll answer all your questions. And I'm like, I only have 24 hours. I tried calling the broker. The broker took a week to get back to me because they don't want to talk to some lonely employee, right? No. And then on the flip side of that is I ended up for that first year having to choose a plan that was so wrong for me because I had to go off of my own lack of knowledge, I should say. And so, I can definitely see why there's 65% waste and why 86% of employees are so confused. For me and my experience in the corporate world, I've kind of had a foot in both worlds for all my career. And it's been interesting because a lot of the organizations that I've joined, it seems like they have 1 to 2 healthcare pushes a year. One is right around this time of year through open enrollment. And then it's almost like in the springtime, they want to do something. They have it planned, like some big walkathon or, like, hey, we're going to do a wellness clinic, or we're going to do a, BMI kind of competition. And in my eye, it's kind of like that. Hey, I have the goal to go to the gym every once a week, my New Year's resolution, and it always fails.
Yep.
But why is it that HR struggles in that? Is it a bandwidth issue? Is it a creative issue? Is it what would you think? What are your thoughts behind why that's such a struggle for education to the employees?
That's a good question. So I will say that a good employer does care about employee wellness. Okay. And so again, we talked early on about the numbers game, or are we running it by spreadsheet?
Yeah.
Good employer will care about the wellness of the employees. They care about the health. A healthy employee is a productive employee. They're engaged. They're not distracted. I mean, think about when you're ill, nothing else matters other than you're not at your best, right? And so we want a healthy workforce. And so good HR teams, my own included, we run wellness programs to try to get people healthy. And again, it's to help drive engagement, to help give, do some activities to change it up. We're not just about work. We do these things too. So, whether it is a 60-day kind of pedometer walking contest, or whether it's, maybe you bring wellness assessments in, or brown bag seminars where we talk about all of the big risk factors, so you do what you want, but participation is always very, very low. So chances are really good. For example, if your company, you say, hey, effective January 1st, so let's say you got 100 employees or 200 employees, we're going to roll out a gym discount. We're going to, I'm going to put $40 a month towards the gym membership of your choice. Chances are that you're just going to help subsidize the gym memberships of the people that already have gym memberships. Mm-hmm. You might get a couple of new takers that might try a gym that may not work out. And so the sad failure a lot of times is you roll out these programs, these contests, these incentives, and the people that are already active participate because they're already doing it. But it's hard to get this to stick for employees, especially under the new guidelines, with the Affordable Care Act, where you can have some great incentives, but participation is all you can measure. You can't measure results. And so, and you have to make reasonable alternatives. So it's hard for us to make it stick. Again, I think the good HR teams will try to incorporate wellness into the mix, but we've always just missed the mark. And they're good programs. They really are well intended. And if you get a few extra people involved, that's a success. But you do realize when you're running those things that you're hitting that same population that is probably already making those good choices anyway.
Yeah. So when you say get more people involved, like what does that look like in your mind? To me, it's kind of like, hey, get more people involved. All right, go out to my call floor and try to round up a whole bunch of people to be on a committee. But I think you're meaning a lot more involved than just that, right?
For me, the ideal would be lifestyle change, meaning that if you are, getting, again, I want to keep it simple, pedometer contest, we're going to track steps for 60 days. If we get somebody, 10 people, 100, 100, very excited about it, and they start walking more as a result of our contest, that's success. If a few people do that, right? And so again, you're gonna already capture the walking and running crowd. They're going to do it just because they're doing it anyway. Right. But the goal will be to capture and make a lifestyle change for a few people. Now, again, I don't know that there's a program out there. We could talk WellTrio in a minute. I'm excited about that, but there's not really programs out there anymore that drive these behavioral changes like we used to be able to with before some of these restrictions. Again, Affordable Care Act, I understand the intent. I also understand the cost, but it kind of tied employers' hands with some of the controls we used to have to drive better behavior. So anyway, but yeah, our goal on the traditional wellness programs, if we could change a couple of people's behaviors, get a couple of people setting better goals, that's success. And we'll keep putting those things out there. Results or no, we'll keep getting creative and trying to create an environment where we're doing more than just creating a workplace. We're creating an experience. So that becomes part of it.
Yeah, exactly. And this is a great segue in, obviously Behind the Premium is sponsored by WellTrio. If you're not familiar with WellTrio is a proactive engagement platform when it comes to risk and optimization management of your healthcare spend. So yes, the one thing that definitely sets them apart, and Rod has touched upon it quite a bit, is the proactive engagement, meaning that each employee gets a one-on-one coach that they get to work with directly for this engagement. And, we've had some pretty good talks with a lot of different brokers that would love to incorporate this kind of thing, but it is a challenge. And it seems like WellTrio's definitely cracked the nut on that. And that's what definitely makes them stand out. So we are excited to have them as a sponsor on today's episode. But yeah, let's kind of keep moving this along with Rod here. With kind of the WellTrio thing of what we're trying to do with the proactive engagement, I agree that is the number one way to get people to make lifestyle changes. Education is one thing. There's being a UI UX designer myself, there's a lot of different psychology models that I use when I'm designing things to measure if people are going to do what I'm asking them to do, right? So if I remember correct, you were a marathon runner, or you still are, or
yeah. Slow, but yes.
So the one thing that I like about it, about one of the models that I use is psychology models. It takes a look at the motivation and the person's ability, and it draws a line, right? Yeah. So if I was to say, hey, Rod, let's go run a 5K, my motivation would be extremely low. My ability to do it would probably be extremely low because I'm bone on bone when it comes to my knees. So I don't run anymore. Yeah. But for you, it's like, heck yeah, sign me up. When do we go? Do you want to do it today? We could jet out early and go run, right? So your motivation doesn't have to be as high, and your ability to do it is extremely high. So it's really easy for you to kind of jump and do these things that we're asking you to do, right? So I know a lot of the carrot stick is, hey, if you go walk 10,000 steps consistently for a week, we'll give you $50 off your insurance premium off your check, right? Or we'll reimburse you $50 on your check. Those are a lot of like carrot and stick kind of models. What are some other things that you have done over the past to kind of educate people when they don't have this proactive engagement like WellTrio can offer?
Yeah, so that's a tough one. I mean, I've done all the carrot things, but let me take you back. I'm going to get a little bit liberal with your question here. So I'm going to go like pre Affordable Care Act, and again, I was working for a large employer. Got very involved with our third-party administrator and decided we were going to run a great, healthy organization. And so for 3 consecutive years, we brought in the wellness assessments. They were always, for me, it's always been first dollar coverage, always been covered up front, 100%, because you've got to be proactive about your wellness. And so, but we brought them on site, and we had a stick involved. If you don't test, your premiums go up. So participation was, that was still the meter, but employees had an opportunity to get reductions on their premium for different metrics that came out of it. Now, we on the HR side, we never knew the results of those exams, but I had premiums that were all over the place. And employees every quarter could qualify for lower premiums if they got those metrics in order, whether it was BMI or tobacco use or hypertension. And so we had some amazing successes there. We ran 5 years in a row with no insurance premium increases. Okay. And again, that still will probably always be my record of consecutive years, and even some reductions. But the best part of it was people thanking me. Employees thought it was intrusive, right? How dare you? Because it's my health, my privacy. But I had dozens of employees thanking me. Thank you for bringing this, and said, I had no idea I was pre-diabetic. Thank you for giving me the motivation to stop smoking. I've smoked for 24 years. I now have the motivation to stop. And so for most of my career, I told people that was the greatest experience for me, to change somebody's life for the better. I mean, they're a better person. They're going to live longer. They're going to be healthier. We rushed pretty much every year we did that. We rushed somebody to the ER from those measurements because of what came out. And so it was a rewarding period. So to go to again, I just have not had that sense, because you can't reward people on results anymore. So, when you first approached me and says, hey, Rod, I've got this group I'm working with. I'd love to run some things past you. I heard wellness, and I thought, again, no disrespect to anyone running, because we've got to be well. But when I heard about the proactive, managed approach to wellness, I thought, oh, this reminds me of what I used to do that actually worked. And so, it was the right formula. It's been exciting to see, and explore what they can do. And I'm convinced it will work for companies. Yeah,
I agree. And, it's interesting because, you think about a lot of these carrot stick opportunities, and it's very similar to, social media, right? People, you can go out and you can post every single day onto a social media platform. But unless you're out there like actually engaging in the comments that are coming underneath, or even just proactively going out and engaging on like your post or my post or somebody else's in the industry, and actually adding value to their post, going in and saying, hey, congrats, that's awesome, I really love this, push the needle. I like to push the status quo on a lot of things and ask why. If you want to ask me about my come to Jesus moment and why I got out of what I did years ago and started into the fractional world, it's probably because of something down those lines, And but it's interesting of how humans require connection. Right. And this is one thing that I've absolutely loved about you. Like, again, I've known you for 20 plus years. One thing that about Rod that I absolutely love is his open door policy to just help and just to educate and to just kind of guide young minds. And I think it's wonderful that you're teaching at the Utah University, Utah Valley University.
Thank you.
They keep changing their name all the time. Who knows what it is these days? But, I remember, a youth group that you set up. We went to meet a VC firm, and it got a lot of the kids educated. And that was because you set it up with one of the people that you knew. Business wise, right? And that's your way of just constantly giving back and having that human connection, which has been amazing. So, when you think about like the upcoming next generation of disruptors, or even just the current HR people that are looking to disrupt in this space, what is the most important questions that HR isn't asking and should be asking?
Focused on the health space or just in general?
In general, from when it comes to either health questions or HR, derivatives of what you guys are doing over there on a daily basis. I know there's multiple facets that you guys fall under, but when it comes to it, what is HR not asking that it should be asking, either in healthcare or just to CEO? Because for me, it feels like a lot of you come across those HR people that aren't necessarily, they're qualified, but they're not knowledgeable or educated in certain areas.
Yeah.
Nothing against them. They're kind of more generalist than they are specifically specialized. But I mean, that's kind of the approach I've gotten. And over the years, I've kind of shied away from asking HR some questions, but
I get it. Yeah. So I think where HR needs to be to make a difference, you've got to know who the customer of the company is. Whoever you work for, HR kind of has this little easy out. So, the employees are my customer. That's your job. Know them, understand them, connect with them. But you need to know your business. You need to know what drives revenue. Without understanding that, you don't know what talent is needed to go in each of the roles, what makes success in each of the different departments in the organization. And so I think a lot of HR people get that wrong. Like, who is the customer? Your customer is the customer, period. And you need to understand that. With that, understanding the business's strategy. Don't isolate yourself to what you do. Don't measure just what you do. Find out how you're driving company key objectives. And I guess the last, there's more, but I'll just throw out there kind of, as you climb the business ladder in your career, the language becomes far more quantitative. And so a good HR professional is going to be able to analyze and understand what is going on very tactically and with data to back it. You're not going to be relying on an analyst to give you your data. You get it yourself, you analyze it, you present your findings, and you solve issues for your employer. You become even more valuable. You predict, you forecast, you analyze, and you become a real strategic member of the team. Again, we're not there just to plan parties. We're not there to recommend another microwave for the break room or a ping pong table downstairs. Sure, do all of that. But if you're not understanding the business, you're in the wrong spot. And on the healthcare side, if you're analytical, you need to get into those reports, request itemized data, push your brokers to get you more frequently. You just get everything you can, understand it, manage the trends, predict where you're going to be at year end. You can forecast what your renewal is going to be if you're on top of these things. And again, so just get into the weeds, understand, study, forecast, and create value.
I love that. And I love how you said, know your business. Data is king, right? We've all heard content is king back in the day. We don't hear it as much anymore, but content is king. I feel like data is its kingdom.
It is.
Because even on my side of design and marketing, for me, you can't argue data, right?
No.
So you can show why this didn't work. And that's the key. Why didn't it work? What can you do to make it work? Yeah. And I think that those are key elements that even a lot of like college kids that are coming out of school these days lack that experience and that kind of knowledge or skill set is to kind of the question, the why. They've been taught out of the books of like, hey, this is how you run a social media campaign. This is how you run this. This is how you do a HR benefits package, kind of thing. But they're not taught to kind of question the why and how it works. And I think that a lot of times there is a lot of overlaying parallels there in lessons, because we don't look at the long tail effect of like how it can actually affect us. Because I know for a fact that some of these insurance plans that we're on for businesses, and mine included, I don't get my data till the end of the year.
Yeah.
And it's like, blows my mind that it's one of the biggest costs for me a year as a business owner. And yet I can't check in on that data throughout the month, throughout the year. And it's that black box that I get at the end of the year that either has a red bow tie on it or a bright green one to make me happy, right? But it's always the red one.
If you think about it, what in the world of investments, right? As a business owner, that's an investment. What in the world of investments would we ever tolerate waiting for an annual statement? Right?
Exactly.
But yet we do. We're subject to, we've allowed ourselves to be subject to this unpredictable, challenging piece, and we just shrug our shoulders, look for the bow tie at the end of the year. And it's unacceptable.
Yep. And do you think that a lot of it, you've been in this industry long enough, do you feel like over the years, the industry is kind of, how's the best way to put this, especially when it comes to healthcare, do you feel like a lot of it has been conditioned from insurers down to brokers down to HR? So it's like, don't ask, this is how it is, just go with the flow. Write the check.
I think there used to be controls that we could put into a plan design and actively monitor and measure. And if you had the right broker or TPA, they would give you monthly reports if you requested. I think that we've lulled ourselves into this sense of kind of a helpless complacency where nothing I can do about it. So why ask? Just please, I'm gonna pray. I'm going to, rub my pennies together. I'm going to try to make some, I'm just going to hope things go well and just let me know, October, if we're going to be okay or not. It's just, I think we've conceded to something that we should never concede to.
Yeah. And it's funny that you say that too, because as a small business owner, it seems like the reports that I do get at the end of the year have become less and less and less impactful on driving decision making.
Yeah.
It's almost like these reports are designed to just be like, hey, here you go, it's Fugazi. This is how well you're doing. That kind of, oh, by the way, here's your invoice. You have 30 days to sign it or else you lose all your insurance. Yeah. It's like, wait, what? Well, explain this to me. Well, here's a guide on how to read it. I'm like,
it's tough. Yeah, there's a few of us that can get through those reports, in short order, but most can't. Sure. It is. I think we've just kind of lulled ourselves to sleep on the matter. Just nothing we can do about it. Just let me know how we did at the end of the year. You would not do that with that investment of anything else in your life, but we do it every year on the medical insurance side of things.
Yeah, and it blows my mind. I do have one follow-up. When do you think that was, you could see that change? Looking back over the years, was there a specific event? Was there a specific year that you feel like that kind of really started changing?
I don't know that I could pinpoint a year, but I can pinpoint a trend for you. My ability to, I guess, control. Again, it's not full control because people's health is what it is, right? But my ability to influence my year-end renewals got less when the Affordable Care Act rolled out, and meaning that my costs were going to go up no matter what. Again, and there's so many good things in there. Just wellness incentives went up, keep the kids on the plan longer. But some of the things we used to influence to try to drive better behaviors, we couldn't do anymore. And so it kind of began then. Keep in mind, the first couple of years, none of us understood what the Affordable Care Act was, even though it was implemented. We were still waiting for things to take. But our visibility became less and less and less, and our ability to influence became less. And so because we couldn't influence that much, we were at the subject to the market more than ever before. And so we could passively track what was being handed to us, but again, without as many levers that we could pull. So I think it began there and has just faded to the point where we just wait and see.
Yeah, I think we've got an episode of Behind the Premium coming up stating, kind of remember the title, something about affordable healthcare is not as affordable as we thought.
Oh my gosh.
So we might have to have you on that one to kind of share your insights and your thoughts on that one. We'd love to have it.
Yeah, it's probably one of the most misnamed bills ever. It has been everything but, and again, there's some good provisions. I don't want to be completely negative, but it is not affordable. Hasn't been affordable for anybody.
Yeah, that's just good marketing, right?
Yeah, that's right. It is. It's packaged nice. Yeah.
Yep, exactly. So, well, Rod, I appreciate you. I just have a couple more questions. I know we're almost at the top of the hour and I want to be mindful to it, but I mean, you've been a plethora of knowledge and expertise. Thank you for sharing it with us.
Thank you.
When it comes to just like various HR people that might be watching this live or even just on the recorded session, what are some good communities? What are some good podcasts? What are some great kind of HR specific disruptors that are trying to push the needle of the status quo in your guys' industry? And what channels, what accounts would you recommend following, especially from a community engagement standpoint?
I think, two big names that stand out to me in the HR space that I just never miss anything from. Dave Ulrich was one of my professors at University of Michigan. I feel like he's kind of the godfather of HR, always insightful. And his group is his company, has just great research, great data. And then right now I'm watching a lot of Josh Burson. I don't think there's anyone else in the space that's as attuned to the future of HR, specifically with tech and AI. Just fascinating to pay attention to him and where he sees the space going. So I throw those two out there as a couple of voices wherever you can find them. They've got video, audio, posts on LinkedIn, and so but those are two names that I'd call out.
Okay, perfect. Love it. Oh, my notes just went away here. Oh, bear with me here for just 1 second. Gotta love technology, right?
Yes,
you click one button and it just totally disappears. All right. So, one of the last questions that I do have is when it comes to, again, I love how you're giving back to the younger generation of knowledge. I think that there's a few other people in your space that are doing that as well. But I really like how you're kind of going down to the college level. If for any of your students that are listening in on this, what advice would you give them in terms of as soon as they graduate, 3 and 5 year goals? Like what should they really be focused on within those first 5 years of graduating? Because I think you're teaching juniors, seniors?
Yeah,
right around there.
I'll catch them their last couple of years of college with HR specific classes. Yeah, I think the advice, I always give advice, your next job will be found through networking. And I also say, get in the door and prove yourself. I think that getting a first HR job is becoming increasingly more challenging, especially with AI coming into the mix. But use your network, use my network. I always offer mine. Use a network, get yourself introduced, get yourself an interview, but focus on succeeding, focus on driving results, show the organization what you're capable of. And there's been some amazing career paths with this, graduates of our program. People are doing great things today that, started out entry level, just like I was a file clerk when I graduated. My first HR job, I did benefits and I filed like old manila folder files. And and was a VP 4 years later, and just go out, prove yourself, work hard, impress leadership with your knowledge and background, and your career is going to take care of itself. And so that's kind of the advice that I would give. But yeah, get in the door, figure out how to get there through your network, and then just impress them.
I love it. And as I tell all the people that I mentor in the UI, UX design and marketing side of things, just open your mouth. Get engaged, get into communities. I mean, that's really what it's all about. Jump on a podcast, get to know somebody and really try to, we call it eat. build your expertise, your authority, and the trust within the community. I echo exactly what you just said there. So
exactly.
Awesome. So this is a Sunstone question. Looking ahead, what kind of things do you see on the horizon for your fractional consulting firm, Sunstone HR? And are there new services? You kind of talked about offering or working a little bit with Trio, but are there other offerings and initiatives that you're going to be trying to do in 2026 that will help you guys even excel more or expand?
Good question. Yeah, I think expansion's the goal. I want it to be like a measured expansion. So for us, it's about getting the right word out. Fractional HR is a new term in the market, and sometimes part of it's just informing the public, then being who comes to mind, when they have a need. And so a lot of proactive marketing, a lot of outreach, a lot of networking will be involved. And it's not just me, it's all the consultants I've got who are out doing the same thing. But our scope of services will remain very much the same, but keep in mind it's custom to every business. And so we can do anything in the people space, but we're going to lean into those gaps that the organization's experiencing. And I got people on my team with expertise across everything, every aspect of the people business. So be kind of the same, just bigger, better, more clients. And so we're looking forward to doing that in the new year.
Love it. Kind of one final question, and this is your 30-second elevator pitch. If I was a business and I was in the elevator with you, why should myself as a CEO or whatever business owner, why should I go with Sunstone HR over other competitors?
We're going to save you money over whatever you're doing today. We're going to drive better results faster, and we're going to improve your business operations. It's a very simple, all positive equation. We're going to do more in fewer hours, which will cost you less money, and we have the insights and experience that will take you to the next level.
I love it. That's a good one. All right. Any final words you want to throw out there?
No, Cody, thank you. I feel bad. That's you've been talking to me. We should reverse roles, and I'll interview you sometime.
Hey, that would be fun. Let's. I'm waiting for those deep rabbit hole, spicy questions.
Okay.
I kind of went a little mild on you. I didn't know if it would give you too much heartburn. No, I'm just kidding. But anytime we'll have you back, and we'll do a real spicy take. There's a couple of good people that we found on the podcast already that have helped us out with the roundtable that I want to get together, and all we're going to do is just have one spicy take on everything that we spill out. So I think it would be kind of fun. My hat's off to you guys, and I mean, you're disrupting. We're talking with brokers that are disrupting, wellness coaches that are disrupting, and even Trio is looking to disrupt. And so that's what this podcast is all about, is finding those people and helping getting the word out. So we definitely appreciate you taking time out of your busy schedule. I know you are extremely busy. I think we had to reschedule this twice. But I'm glad we found the time to do it, and I appreciate you taking time to do it. But other than that, check out what is your let me see if I can pull this up here, and we can screencast real quick, and you can do a call out for your group here. This is the website, right? sunstonehr.co.
.co, yep. Sunstone HR. Okay. Just
Perfect.
Like it sounds, yep.
Yep, perfect. And you guys are on, looks like LinkedIn, Facebook, Instagram, and YouTube.
YouTube, yeah.
So perfect. Yeah, so definitely check them out. If you have any questions, definitely DM Rod on LinkedIn, and he'll get back to you as soon as possible. So, but other than that, thanks everybody for tuning in. Thanks again, Rod. We will catch you on the next episode of Behind the Premium. See you, everybody.
Thanks, everyone.